Hey everyone, we have here the topic specific learning disorder under neurodevelopmental disorder. So when we say specific learning disorder or SLD, it is a condition characterized by performance that is substantially below what is expected based on the person's age, IQ score, and educational background. So bisan pa og normal ang IQ sa isa ka bata og nag-eskwela siya sa right grade level or expected grade level niya, ang iyang academic performance, especially sa reading, writing, or math, kay mas ubos kaysa sa expected. Hence, ang SLD is also called unexpected underachievement. Kay wala gi-expect nga mas muubos ang ihang performance based sa ihang ability. For example is the dyslexia. Then, SLD is not just about the lack of intelligence, but about difficulty in specific learning areas despite having above average or average intelligence. Then next, we have here the case study of Chloe taking a learning disorder to college. So, Chloe is a 20-year-old college student nga naglisod sa iyang pag-eskwela since she was in grade 6. Bisan pa og naningkamot siya, bisan og kanang taas ang ihang IQ which is slightly above average, sige gihapon siya og struggle sa iyang mga klase. Even teachers told her nga she wasn't reaching her potentials, hence mas naapektuhan ang iyahang self-esteem. Pag abot sa high school o college, mas niubos pa ang iyahang self-confidence or kumpiyansa sa iyahang kaugalingon. Kay gasigi gihapon siya og struggle sa iyahang mga klase. Later, Chloe decided to seek professional help. She was assessed and diagnosed with specific learning disorder, particularly in reading comprehension. Kaya ang problema diay ni Chloe is maglisod siya og remember sa iyahang gipang basa which made studying very difficult. Kay bisan pa og mo take time siya og tuon mo abot siya og pila ka weeks, pila ka days mo advance reading sa certain topic, inig abot sa exam, tanan iyahang mga tanan ihang mga nabasahan or ihang mga natun-an is makalimtan ra niya. But Chloe didn't give up. She used strategies like reading aloud, taking notes, and audiotaping lectures. By using those strategies, she graduated sa university, even if she didn't become an A student. And today, Chloe is using her experience to help others. She now works with children who have learning disabilities. And by just reading the case study of Chloe, we can get the moral of the story that specific learning disorder does not mean person is not intelligent. It just means that they need the right support and strategies. Then next, we have here the diagnosis of specific learning disorder, particularly in reading. So to diagnose specific learning disorder in reading, there are two main criteria to consider. First is discrepancy in achievement, where the person's academic performance, especially in reading, is significantly below what is expected based on their IQ and age. For example, even if the person has an above average IQ, maglisod gihapon siya og sabot or hinumdum sa iyang gibasa. Parehas sa case study ni Chloe earlier. Then next, we have here the exclusion of other factors. This means that reading difficulty is not caused by other issues such as vision or hearing problems or by poor instruction. In short, the difficulty must be specific to how the brain processes reading and not due to external reasons. So if there were two main criteria to diagnose SLD, now we have two main approaches in identifying specific learning disorder. First is traditional approach or IQ achievement discrepancy, where gitanaw ang kalahian sa IQ score ag academic performance. If the student's achievement is more than 2 standard deviation below their IQ, possible nga na ay learning disorder. However, this approach has been criticized kay late ma-identify ang problema, usually during upper grades na. The second and more modern approach is called RTI or response to intervention. So sa RTI, ang bata tagaan og effective interventions like reading programs. And if students does not improve despite good teaching, then it may indicate a learning disorder. This method allows for the earlier diagnosis and support, which is helpful para dali matabangan ang isa ka bata. So, in summary, the traditional approach focuses on the gap between IQ and performance, while the RTI focuses on how the student responds to help. Next, we have here the statistics. The term communication disorder refers to a group of conditions nga closely related sa specific learning disorder. Sa una nga tan-aw dili ni sila tan-awon nga grabe or disruptive, pero kung dili gani matagad, disorders can cause serious and long-term difficulties sa communication and social interaction. According to the American Psychiatric Association, communication disorders often start in early childhood and can affect a person's ability to effectively express or understand language, which makes it hard for them to engage with people and their environment. So these disorders include conditions like childhood onset fluency disorder, or kanang magka-bitawg istorya or mag-stutter, then language disorder or lisod sa paggamit or pagsabot sa sinultian. Next, we have here the diagnostic criteria for specific learning disorder. So, SLD is a condition where a person has a difficulty learning and using academic skills such as reading, writing, or math. So, sa DSM-5, upat ka diagnostic criteria nga kinahanglan ma-met. So, first, there must be a clear difficulty in at least one academic area, like slow or incorrect reading, trouble understanding what is read, poor spelling, disorganized writing, or math difficulties like solving problems or understanding number concepts. Kini nga mga problema must last for at least 6 months. Bisan pa og gitagaan na siya og interventions or support. Second is the person's academic skills are substantially below what's expected based on their age and intelligence. Ug kini maka-add up og stress sa school, trabaho, or daily activities, and this must be confirmed through standardized testing and full clinical assessment. The next is the learning difficulties begin during school age years. Pero dili dayon makita usahay until mas grabe na ang academic demands. Like katong kang Chloe gastart siya o grade 6 pero mas nisamot pag-abot og high school o college. Kay sa college na reports, daghan ng exams na. Then lastly, we have here the problems that better explained by other conditions like intellectual disability, hearing or vision problems, mental or neurological disorders, lack of language proficiency, or poor teachings. So, there are different types of SLD. So, with impairment in reading or kanang maglisod og comprehend, and with impairment in written expression like maglisod sa grammar, maglisod og clarify or kanang spelling, then with impairment in mathematics like walay number sense or math facts, then maglisod og problem solving. So in summary, SLD is not about being less intelligent. Ang bata or individual, ang isa ka bata or ang isa ka individual is kanang smart man sila pero na specific nga area lisod para nila and needs proper support and understanding to succeed. The next is the causes of specific learning disorder. So there are different theories explaining the causes of specific learning disorder, which include genetic, neurobiological, and environmental factors. In other words, SLD can be caused by a combination of internal and external influences from how the brain works to the kind of environment a person grows up in. So we have here the biological. These causes involve genetics, differences in brain structure or function, and neurodevelopmental issues. Kung naay learning problems sa isa ka pamilya, there's a high chance nga maapektuhan pod ang isa ka bata, and it can be inherited or caused by how the brain develops. The next we have here the psychodynamic. Emotional factors like childhood trauma, low self-esteem, and emotional conflict may affect learning. So, ang mga bata nga nagaagi og traumatic experience or emotional struggles can have difficulty focusing and coping in school. Then, next is behavioral. This focuses on how a child's behavior is shaped by experience. Poor reinforcement, learned avoidance, or kanang if nailisod gani nga situation, avoidance sa bata ina na or likayan, and inadequate instruction can cause or worsen learning difficulties. Then fourth is cognitive. Problems with memory, attention and processing speed, and metacognition or pag-manage sa kaugalingong learning can make academic tasks more difficult. Bisan pag brighting sa kabata, if he or she struggle to focus or process information quickly, maapektuhan gihapon ang isa ka performance. Then lastly is socio-cultural. These are factors related to the environment. Things like poverty, language or cultural barriers, and low education support can make it harder for a child to succeed in school. For example, kung ang bata dili kasabot sa language sa klase or walay support sa balay, maka-trigger kini sa learning issues. The next is the genetics and learning disorder and what the research shows. So, research shows that learning disorders often run in families. Meaning, kung naay learning difficulties ang mga ginikanan, naay possibility nga ang ilahang anak maapektuhan sad. This suggests that genetics play a big role in learning disorder. However, it's not as simple as one gene causes one disorder. Dili siya ingon anak ka diretsyo. Instead, studies show that many genes can contribute to learning difficulties, and each gene may affect different areas of learning like reading, writing, or math.